So what we've seen today is a resounding vote for strike action by junior doctors. I think you have to remember that this is a profession that have seen massive real-term pay cuts over the last 12, 14 years. Of course, there might be kind of good salaries at the end of the tunnel, at the end of the career, but the starting salaries for junior doctors are often below £30,000. You take into account the spiralling cost of living, and you can see why there's been such a resounding vote today.
Lots of similar professions, of course. We've seen downing tools even within the health service. Is there many people, perhaps understandably, Chris, will say, hang on, this is piggybacking on a certain kind of momentum at the moment. Is that more what this is about? And what a great chance to try and, get yourself a few quid in the process.
So I think the reality is that the strikes are sounding a red alarm, a fire alarm on the sheer state of healthcare services in this country at the moment. We see huge amounts of pressure on services when you've got 7.2 million people waiting for care. That's 1 in 8 people in England waiting for care. And a lot of that is down to the pressures that are on staff. It's down to the difficulties the health service has in recruitment and retention, thanks to things like pay freezes and real-term pay cuts in the last 15 years. So I think it's a reaction to those pressures, and we should see this as an opportunity for government to step up to fix the big problems healthcare is facing, and to do, what could be a more clear people's priority than getting the NHS back to full strength.